Where can you find comprehensive medical services, expert clinicians, newly renovated spaces, and a breathtaking view all in one location? Only at the Des Moines University Clinic. Call today or visit dmu.edu/clinic.
Hello and welcome to the Student Osteopathic Orthopedic Association's presentation on common orthopedic problems for the 50 and Better Health Fair. My name is Jake Rogers. I'm the association's current president, and I, along with my board members Jacob Frisby, Ben Jacobs, and Taylor Keller, will be discussing common orthopedic problems that are seen in the 50 and better population. Today we will be talking about rheumatoid arthritis, carpal tunnel syndrome, osteoarthritis, joint replacement, and low back pain.
Our first topic today is rheumatoid arthritis. RA is an autoimmune disease, meaning the immune system is attacking the body rather than foreign invaders. Abnormal immune cells create antibodies that stick to things they shouldn't. This will result in soft tissue, cartilage, and bone destruction. So in sum, RA is a condition of joint destruction accompanied by damage to the heart, lungs, kidneys, blood vessels, and other organs. It most commonly affects the hands and feet, but it can also affect the knees, spine, elbows, ankles, and the shoulders. So what causes rheumatoid arthritis? The initial cause is unclear, but there are known factors that increase the risk of developing RA. Females are 2 to 3 times more likely to develop RA than males, which is true for most autoimmune conditions. The risk increases with age, with the most common age of onset being 40 to 60 years old. Obesity increases the risk of developing RA. And smoking not only increases the risk of developing RA, but it can also make the condition more severe. Rheumatoid arthritis can be treated with operative or non-operative methods. The operative methods depend on the specific case and the deformities that are present. These methods are not as common as they used to be, though, because of advances in medications to not only treat the symptoms, but also to slow the progression of the disease. Non-operative methods are based in medications. The first-line therapies include steroids, NSAIDs like Aleve or ibuprofen, and even some chemotherapy drugs and drugs used to treat malaria have been found to be effective. The second-line therapies include disease-modifying anti-rheumatoid drugs, or DMARDs. These are our heavy hitters, and they attack the dysfunctional immune system to treat the underlying condition and slow the progression of the disease.
Carpal tunnel syndrome is caused by compression of the median nerve at the wrist joint. The median nerve travels down the arm and through a passage in the wrist called the carpal tunnel. When this area is irritated or inflamed, the surrounding structures compress the median nerve and cause numbness and tingling in the hand. Though there is no definite cause, the condition is thought to be related to repetitive motions of the wrist. Pregnancy, diabetes, obesity, and many other health conditions are also thought to increase the risk of this syndrome. This condition is present in up to 5% of the U.S. population, with a higher prevalence in females and a peak age between 40 and 60 years old. Symptoms include numbness, tingling, shocking sensations, and hand weakness. This condition also commonly presents with the patient being woken up at night with these symptoms. This condition is often diagnosed clinically based on the symptoms the patient presents with. Doctors can also perform a nerve test called an EEG to test the function of the median nerve. There are a wide range of treatments for this condition. Non-operative management includes the use of nighttime splints, non-steroidal anti-inflammatories, and steroid injections into the carpal tunnel. There is also a surgical option where the transverse carpal ligament is released, relieving the pressure on the median nerve. Some items that may prevent carpal tunnel syndrome includes avoiding repetitive movements, taking breaks from typing, and wearing a brace during repetitive wrist activities.
Osteoarthritis is the most common type of arthritis. It's estimated that about 32.5 million Americans suffer from osteoarthritis, and it's the result of cartilage breakdown between the bones which is due to normal everyday wear and tear. Some risk factors that may make you predisposed to the development of osteoarthritis are being over the age of 60 years old, obesity, any type of trauma. Your genetics can put you at a higher risk for osteoarthritis, and it is more common in females. So how do you know if you have osteoarthritis? The general symptoms of osteoarthritis are joint pain, stiffness, and swelling. And this is usually seen in the weight-bearing joints of the hip, the knee, and the lower lumbar spine. Typically, the symptoms improve with rest, and they're usually worse at the end of the day. Now, if you do have osteoarthritis, there's a few things you can do to help improve your everyday pain. The first of which is lifestyle changes. As I mentioned before, obesity is a major risk factor for the development of osteoarthritis, and incorporating some healthy lifestyle changes like exercising, losing some weight, and having healthy eating habits can really help improve this arthritic pain. Additionally, medications can help improve this pain. You can do some over-the-counter painkillers in addition to prescription. However, it's always best discussed with your primary care physician as to what medications are best for you. Additionally, you can also look into knee injections. This will help lubricate and cushion the joint and help alleviate some of that pain. And if you've tried knee injections and medications and incorporating lifestyle changes into your life, and you still have not experienced pain relief, you can look into the possibility of having a total joint replacement as a last resort option. Joint replacements are typically a last resort therapy for people with arthritis, and these are fairly common procedures. Approximately 1 million Americans will have joint replacement surgery every year. If you look on the right-hand side, you can see a depiction of both of a knee and a hip. The knee is on the top, the hip is on the bottom, with arthritic damage, and it shows how this can be kind of replaced with a metal or plastic implant. This implant is used with the goal of reducing pain, and if the surgery is done successfully, generally it improves the quality of life. And these replacements have been getting better recently, and it's estimated that most people that get total joint replacements now, these replacements will typically last about 20 years before they wear out. So how do you know if getting a joint replacement is right for you? The best thing to do is to have a conversation with a physician, with your primary care physician and an orthopedic surgeon, to see if you are a good fit for a joint replacement. And some questions that you can ask yourself prior to these meetings are, can you do the things that you enjoy doing? Do you get any pain relief with any medications that you're taking? Can you sleep through the night without waking up due to pain? And last of which is, does your pain prevent you from doing daily activities? I mean, can you get into and out of a car without significant pain, or into and out of a chair without significant pain? And if you answer yes to any or all of these, it could be a time to talk to a physician to see if you're a candidate for surgery.
Hello, this is Ben Jacobs, and I'll be taking you through our last orthopedic topic of the day, which is low back pain. So low back pain has a variety of causes, and along with those causes has a variety of symptoms. So we'll be covering those on the next slide. As you can guess, low back pain is not an exclusive orthopedic issue. So many different medical specialties will be involved in the treatment and care of this clinical presentation. So the prevalence of low back pain is very high. 84% of the world population will have a bout of low back pain at some point in their life, whereas 26% have had at least one day of low back pain in the last 3 months. Some risk factors include smoking, obesity, increasing of age, and then we do see a slight increase in the amount of females that present with low back pain over males. So over the wide variety of causes that I was talking about earlier. We have nonspecific low back pain, which constitutes about 85% of the cases. We have serious systemic low back pain, which is less than 1%, and those are going to be your really debilitating diseases. And then it is classified as less serious. I use quotes there for a reason, but very specific causes of low back pain constitute just under 10% of the total cases. Of the non-specific cases, most of them will resolve in 1 week, usually without the help of a physician. Your symptoms for this are going to be general, dull, aching pain. These won't necessarily completely debilitate you from doing activities you would normally do in your daily life, but they might make them a bit more difficult. Of our serious systemic low back pain causes, we have spinal cord compression, which is usually caused by a disc herniation. These symptoms are broken down based on how long the disease has prevailed in the body. So early signs are just going to be a general pain. You're not going to be able to narrow that pain down to a specific location. Midway through the course of this disease progression, you're going to see muscle weakness, and late you're going to start seeing bowel and bladder incontinence. Second cause, that's a serious systemic cause, would be metastatic cancer. Many types of cancer will metastasize to the vertebral bodies preferentially over other bone in the body, and especially within multiple myeloma, we see 60% of patients will have these bone mets. These will be denoted with a sudden pain. It could indicate a fracture, but this is going to be a lot more localizable. And the last of our serious systemic is going to be our vertebral osteomyelitis. This is just a very nonspecific term that indicates an infection of the vertebrae. We're not sure what's the cause of it, but this one is specific in the sense that you will feel pain, extreme pain with pressure to your lower back. And finally is our less serious but specific causes. This includes a compression fracture. A compression fracture can happen for a variety of reasons. Usually falls are the biggest indicator. And this can have a big range of symptoms depending on the etiology of the fracture. So this can be no pain to completely immobilizing you. Our second would be radiculopathy. This is damage or just impingement to spinal nerve roots, but the more serious issue would be damage. And this is going to have that sharp, zinging electrical pain down a specific body segment. In low back pain, you're usually going to see this down the legs. We refer to this as sciatica. And finally, we have spinal stenosis. Spinal stenosis is caused when you have a slipping of a vertebral body due to a fracture, due to laxity in ligaments. So you're going to feel pain in your lower legs when walking. And this one has a classic sign that's associated. It's called the shopping cart sign. And this is where your pain is usually relieved when you're sitting or when you're bending over. So think of a person at a grocery store who will be significantly hunched over their shopping cart in order to just go on with their daily routine. And this is not an exhaustive list by any means. Some other causes include ankylosing spondylitis, osteoarthritis, which we talked about earlier. We have scoliosis. There's a ton of psychologic issues that can manifest as low back pain. Piriformis syndrome and sacroiliac joint dysfunction as well. So after we've talked about all of these different causes, the real question becomes is when to see a physician. So I've kind of broken this down on different tiers that kind of correlate with a lot of the disease progression we just talked about. So your normal state should be no pain. I can't stress that enough, is that normal is no pain. Our next step is abnormal, which is any amount of pain. So any amount of pain should be monitored closely. Watch it day by day, see if it's getting better or worse. Watch it to see if it's getting better or worse with different motions, or if it's hurting when it's stationary. All of these things are good things to take note of. When to see your physician. If this pain persists for longer than 6 weeks, that's about the time point that we're saying, okay, we want to see you in. This could be bad and we want to catch it early, or it could be nothing, but either way, peace of mind, head in at 6 weeks. Any pain associated with recent trauma. Trauma could be a fall, could be a motor vehicle crash, anything of that nature. If you have any numbness or tingling, that's something to definitely take a note of and definitely bring up to your physician. any difficulty walking, bowel bladder incontinence, and then pain that wakes you up from your sleep are all indicators of kind of an advanced disease progression, and you would definitely want to get in to see your physician as soon as possible.
On behalf of the Student Osteopathic Orthopedic Association, thanks for watching.
Des Moines University Radiology offers imaging services to our patients and outside referrals. In addition to traditional x-rays, we offer state-of-the-art imaging technologies for measuring bone mineral density and body mass composition. One of the imaging services in high demand is body composition analysis, or BCA. Our simple scan measures a person's total body fat composition as well as the ratio of lean mass to fat mass in each arm and leg, the head and trunk. If you want to stay in good health, this will provide you with a detailed analysis of your body, including measurements of true body fat percentage, ratio of fat to lean tissue, and color-coded body mapping. Because BCA analysis is considered the gold standard in measuring the body composition, people often use the information when planning a workout routine, changing diet, or making a lifestyle makeover. Too much fat can lead to serious health problems like heart disease, diabetes, and joint disorders. Measuring body composition provides a more accurate picture of your overall health than simply stepping on a scale or calculating your body mass index. Many older adults use BCA to keep track of their body fat ratio and markers for obesity. Scans only take a few minutes and use less radiation than you would receive on a commercial flight. One short, simple scan provides a wealth of valuable information about your health. You can map your lean, fat, and bone mass, see real body fat percentage, and identify your risk for metabolic diseases by measuring your visceral adipose tissue. That's the fat on the inside around your organs, not the muffin top that you can pinch. It's a fast and low-cost process that does not require a doctor's order, and results are available the same day. We invite you to take a new look at your health.